Okay, let's start with the location. Okay, so in the body, a majority of the serotonin is produced in the enterochromaffin cells. Okay, again, a majority ng serotonin in the body, they are produced, sulat na ko ha, they are produced in the enterochromaffin cells. Okay. Now, yung enterochromaffin cells, these are found in the GIT. Okay, these are found in the GIT, particularly in the small intestine. Okay, this is found in the small intestine. Lahi po itong enterochromaffin-like. Ito yung totoong enterochromaffin cells. They are located in the small intestine. Yung ECL, yung enterochromaffin-like cells, sila yung found in the fundus of the stomach. Okay? They are able, diba, to produce histamine. For enterochromaffin cells found in the small intestine, they actually produce, they synthesize about 90%, no, of serotonin in the body. Again, they are able to synthesize about 90%. So meaning pinaka daghan gid nga serotonin ma-produce dito sa enterochromaffin cells. Okay? And from the intestine, yung serotonin will undergo active uptake to the platelets. That is why there are serotonin that are also present in the platelets. So from the enterochromaffin cells from the small intestine, mo undergo og reuptake process ba ang serotonin into the platelets. Okay? That is why, again, serotonin are also present in the platelets. And finally, there are serotonin that are synthesized from the CNS. Take note, there are serotonin also that are synthesized in the central nervous system. Okay? Now, under CNS, kung 90% ang masynthesize sa EC cells, sa enterochromaffin cells, sa CNS naman is about 10%, okay, of serotonin, okay, is synthesized sa brain, okay, or sa CNS. Okay, so that is the location for the location of serotonin. Next, let's proceed to the biosynthesis, or let's say the storage and the release, no, of serotonin. Okay, so somehow this figure, it is quite familiar, diba, sa inyo, ha? Kay ingani akong pagka-discuss sa cholinergic and adrenergic neurotransmission ng impulses, diba? So for this figure, it actually presents the transmission of impulses, yung transmission ng balita from the brain towards the effector organs. Okay? So for this figure, this will represent here the biosynthesis of serotonin in the CNS. Okay, in the CNS. Later on the preceding slide, I will present the biosynthesis of serotonin in the enterochromaffin cells. Okay. So again, for CNS, sa CNS, there are only about 10% ng serotonin in the body that is synthesized here sa CNS, sa brain. So para madali lang ang ato ang discussion diri, ako gihapon siyang hation into 3 parts. So, I know familiar na mo ani nga figure. Okay? So, yung taas nga part is for the pre-synapse. Diba? Pre-synapse. Yung nasa gitna is for the cleft or synaptic cleft. Yung nasa baba is for post-synaptic cleft. Not cleft. Post-synapse. Okay? Sige. So, under pre-synapse muna. Under pre-synapse, this is where, diba, synthesis, storage, and release of neurotransmitter or particularly serotonin will take place. Again, diri mahitabo ang synthesis, ang storage, and release. So, let's start with synthesis. Let's start with synthesis of serotonin. Okay, for synthesis of serotonin, I'll begin with this compound. Okay. Kanang na-star. That is specifically an amino acid. Diba? That is an amino acid in the name of tryptophan. Okay? I believe you're all familiar with this amino acid, tryptophan. Diba? Tryptophan, this is considered as an aromatic amino acid. So, in this figure, okay, in this pathway, it is considered as the precursor. Okay, siya yung precursor nga amino acid, okay, in the biosynthesis of serotonin. Now, when we say precursor ulit, yan yung kailangan natin na raw material to produce the said amine neurotransmitter. Okay? Now, inside the presynapse, ang fate, ang always na fate of tryptophan is that it will be catalyzed by an enzyme. Okay, and that enzyme is called tryptophan hydroxylase. So ito yun. This is the enzyme tryptophan hydroxylase. Now, once catalyzed, this reaction will cause formation of an intermediate product. And that intermediate product is 5-hydroxy-tryptophan. Intermediate product again is the 5-hydroxytryptophan. Okay, and for this intermediate product, this will serve then as a substrate for another enzyme. Okay, and that enzyme is known as aromatic amino acid decarboxylase. So it will undergo decarboxylation reaction, which will further result to formation of another compound. Okay, and that is already the serotonin. Diba? 5-hydroxytryptamine, this is the chemical name of serotonin. Okay? Again, 5-hydroxytryptamine, that is the chemical name of serotonin. So, done with the synthesis. Okay? So, check na ta sa synthesis. Now, whenever yung serotonin is formed, let us proceed to storage ha. Storage na ta. Whenever na-form na, na-synthesize na ang serotonin, this will undergo specialized process. Okay? It will undergo a specialized process. And that process is called vesicular storage process. Okay? Vesicular storage. So, it will undergo vesicular storage. Okay? So, we have here, ito, yung serotonin. Okay? That will enter. It will enter the vesicles. Kaya nga vesicular storage. It will enter the vesicles. And that entry is made possible by this transporter. That transporter is called VMAT. Okay? VMAT. Vesicular monoamine transporter. Okay? So the same no ang process sa adrenergic. Okay, yung adrenergic neurotransmission, yung sa dopamine, norepinephrine. Kato. The same lang gihapon ilang transporter for it to enter into the vesicles. Okay, VMAT. Again, VMAT is vesicular monoamine transporter. Now, I believe you already know the essence of the entry of serotonin into the vesicles. Please take note. Any any nga neurotransmitter that is synthesized in the presynapse, it is very important for them to store in the vesicles. Okay? It is important for those neurotransmitter nga na-form sa presynapse to be stored inside the vesicles. Why? To prevent premature metabolism. Why is it na ay possibility of metabolism inside the presynapse? Sa ganito ang makita sa presynapse. Very good. Because of the presence of enzymes in the presynapse, kailangan i-enter sa vesicles ang mga neurotransmitters. So that is all about for the storage. Okay, that is for the storage of serotonin. Okay, so na-store na siya. Let us proceed to release. So somehow medyo paspas na inyong pag-catch up sa ideas. Diri kay same raman ang pattern sa prior nga mga discussion. Now with regards to the release, the same process lang gihapon ang release that will happen to serotonin. Okay? Ultimately, diba na ay calcium, wala lang gipakita dire, diba na ay calcium ion that will enter, okay, via a calcium ion channel, yung voltage-gated ion channel. And then that calcium ion will cause the attachment of those docking proteins. Kung naka-remember pa mo katong docking proteins, it will attach to the membrane. Okay, yung mga docking proteins, mo attach siya. And that will release serotonin. Okay? And the process of release ng neurotransmitter ng serotonin here is also exocytosis. Okay, exocytosis, yung release ng serotonin. So at the end of all these processes under presynapse, we tend to observe then nga yung serotonin is now available sa cleft. It is now available in the cleft. Now let us proceed to the possible fates. I will just finish this slide. Then I will provide a pre-recorded lecture video for the rest of the topic. Okay? Sige. So for the cleft, possible fate. Ano yung mangyayari ng serotonin kapag available na siya sa cleft? Okay? So for any neurotransmitter in the cleft, recall nga isa pinakauna nga fate nila is for it to bind, di ba, sa postsynaptic receptor. So binding to, di maklaro ang ink. Sige. So binding to postsynaptic receptors. Okay? Yan yung isa sa mga common yun nga fate kapag available na yung neurotransmitter, di ba, sa cleft mo, bind yun na siya sa serotonin receptors. Man makita ang serotonin receptors nasa post-synapse. Okay? And of course, binding of serotonin into the postsynaptic receptor, that will lead to enhanced serotonergic effect. Positive yung serotonergic neurotransmission, enhanced yung serotonergic effect. Now, the other possible fate ng serotonin if available in the cleft, which is somehow predictable, is, di ba, metabolism. Okay, metabolism. Recall that there are enzymes, no? There are enzymes, okay, present also in the cleft. Example, enzymes present in the cleft that metabolizes serotonin is yung MAO, monoamine oxidase. Okay, monoamine oxidase. Okay, so that is an enzyme that metabolizes serotonin. The same enzyme that metabolizes norepinephrine, di ba? Dopamine. Bakit the same? Kasi those are amine, no? Meron silang amine in their structure. Okay? Then lastly, ang mostly pronounced na mechanism of removal of serotonin sa cleft is the so-called reuptake process. Okay, so no problem again with this term. Okay, yung reuptake process. If you recall, di ba, the term reuptake process, as the term suggests, reuptake, ang serotonin, this serotonin, lantawa ang arrow, it will re-enter, di ba, reuptake, it will re-enter into the presynapse. And it will be stored again. Follow the arrow, it will be stored again in the vesicles. Okay? So that is another possible fate also ng serotonin. And again, same with adrenergic neurotransmitters, yung norepinephrine specifically, much more pronounced or majority of the serotonin in the cleft, ang ilahang major nga fate is reuptake process. Okay? Now take note, itong reuptake process ng serotonin into the presynapse, that is facilitated by a transporter. Okay? This transporter, kaning transporter, I labeled, this is known as serotonin transporter, or that is abbreviated as SERT. Serotonin transporter. Yan yung SERT. That is a transporter that facilitates reuptake process of serotonin. Okay? Now, because of serotonin, okay, because yung serotonin is being reuptaken into the presynapse, question, what will happen now to the level of serotonin in the cleft if it is being reuptaken into the presynapse? What will happen to the level of serotonin in the cleft? Very good. It will decrease. No, it will decrease. Lowered ngayon yung level ng serotonin in the cleft. Okay, what about sa metabolism? If prone to metabolism, more serotonin are metabolized in the cleft, what will happen to the level of serotonin in the cleft? It is also yes, very good. It will also decrease. Okay. For a while, for a while. Okay, so let's resume. Now, so that is for the possible fates of serotonin when it is available in the cleft. So with metabolism, pag-enhance yung metabolism ng serotonin in the cleft, lesser yung serotonergic effect. That's good. Now let us emphasize this time the events that happen during reuptake. Okay, yung during reuptake process ng serotonin. Okay, tandaan, class, the moment nga gi-reuptake si serotonin into the presynapse via SERT, of course, serotonin gets reloaded, diba, into the vesicles. So, ma-reload siya into the vesicles. But there will be serotonin nga dili ma-store back sa vesicles. Okay, naatay mga serotonin dira nga dili ma-store back to the vesicles. That is why they will be prone to metabolism with the enzyme MAO. So we also have MAO, monoamine oxidase, present in the presynapse, particularly monoamine oxidase A, kasi there are two types of monoamine oxidases, MAO-A and MAO-B. Yung MAO-A is the one that is capable to metabolize. Take note, this is the one that is capable to to metabolize norepinephrine, epinephrine, and serotonin, yung MAO-A. Kasi yung MAO-B na type of enzyme, that is only capable to metabolize dopamine. So it has nothing to do with serotonin. Okay? Now, kung ma-metabolize yung serotonin with MAO-A, okay, MAO-A, that will inactivate, of course, serotonin. That will inactivate serotonin. So you tell me what will happen to the level of serotonin inside the presynapse kapag na-metabolize siya with MAO-A. It will also okay, very good. Very good. It will also decrease, bababa din. Okay? So very good. Very good. Okay. So overall, these are the possible fates, possible fates of serotonin in the cleft again. Binding to postsynaptic receptor metabolism and reuptake process. Okay. So I hope you already understand, kapag reuptake process, bababa ang serotonin sa cleft. Paano pag may inhibitor of reuptake process, kabaliktaran? Okay? Same with sa MAO-A inhibitor. Paano pag may MAO-A inhibitor present? So kabaliktaran din. Okay? It will enhance the level of serotonin. Okay? And finally, dali na ta, sa post-synapse, tandaan lang na dito makikita yung mga serotonin receptors. Kaning gipang encircled, ano siya, mga serotonin receptors present in selected organ. So kapag nakapag-bind na yung serotonin into the receptors, that is already an evidence na yung impulses mula sa brain, okay, na-transmit na into the effector organ. Okay? So those are the most important notes, okay, under the serotonergic neurotransmission. Now, I have mentioned earlier, there are only about 10% of serotonin synthesized or produced in the CNS. And majority of the serotonin are produced in the enterochromaffin cells, which is most of the serotonin are produced, synthesized in the cells, is that majority of the source of tryptophan, majority of the source of this tryptophan is coming from our diet. Okay, majority of the source of tryptophan is coming from our diet. So upon intake of any tryptophan rich foods in our diet, in the small intestine, it will be utilized in the synthesis of serotonin. Now, in this figure below, this shows the synthesis of serotonin both in the in the CNS. Okay, in the CNS. Now, with regards to the synthesis, again, they follow the same processes. Okay, so this part here, this has something to do with the synthesis of serotonin in the CNS, whereas above is for the synthesis of serotonin in the enterochromaffin cells. Now, initial raw material needed is tryptophan again. Take note, di ba? So, ayan. This is actually a magnified portion of each cells. So, yung mga kulay green, take note, yung mga kulay green sa small intestine, sa intestinal epithelial cells, those are enterochromaffin cells. I repeat, yung mga kulay green dyan, ito, yung mga kulay green embedded in the intestinal epithelial cells ng small intestine, those are enterochromaffin cells. So, again, majority, about 90% of serotonin are produced here. Then yung sa baba, ayan, this is a magnified presynaptic, okay, synapse of a neuron, okay, in the CNS. So, ayan. So, let us have a comparison of the two, okay? Actually, the same lang yun. Okay, the same lang ang process that they follow in the synthesis of serotonin. So again, the raw material needed is tryptophan. Tryptophan. Okay, and with the aid of the rate-limiting enzyme, the rate-limiting enzyme is a tryptophan hydroxylase, Okay, so the reaction will proceed until serotonin will be produced, until you have a serotonin 5-hydroxytryptamine that will be produced. And again, this 5-hydroxytryptamine will undergo a specialized process of storage, vesicular storage, okay? And then its release, okay? Its release is via exocytosis. So, ayan. Yung mga kulay pink dyan, those are released serotonin. Okay? And it will now be ready to be binded to the serotonin receptor. So you have there serotonin receptors. Serotonin receptors. Okay? And take note, majority of the serotonin that has been released will be reuptaken. It will undergo reuptake process with the aid of the transporter, serotonin transporter. So it will be transported, it will be facilitated via SERT, okay, pabalik sa vesicles. And there will be serotonin, upon a reuptake process na prone to malodegradation. Okay? Yung mga hindi na ka-re-enter into the vesicles, yung mga serotonin na yun are prone to degradation of MAO. Okay? So you have there MAO. Okay? So it will be degraded into inactive form. Okay? So it will be degraded into its inactive form. Okay? So you have there the 5-hydroxyindole acetic acid. Ayan. You can search it, no, sa Google. 5-hydroxyindole acetic acid. Okay. Now, let me proceed to the general effects of serotonin once synthesized or produced. Okay. So, kapag yung serotonin is already available, whenever it is synthesized already by the brain, okay, it is already synthesized by the brain, okay, and by the enterochromaffin cells, making it available in the blood vessels, particularly in the platelets, this serotonin will now possess peripheral effects and central effects. Okay. Now, under central effects, serotonin may manifest anxiety, psychosis, okay, depression, sleep aggression, and increase of appetite. Okay. Again, serotonin is very important. okay, for mood regulation. Okay, so these are part of mood regulation. We have also increasing appetite. No, this one is for increasing the appetite. What else? Part of CNS effects, it induces sleep. No, it is a sleep promoter. Okay? For depression, kapag sobrang baba ng serotonin, okay, that will cause depression. Okay? Others, other central effects would include emesis. Okay, emesis, and also thermoregulation. Okay. Then for the peripheral effects in general, peripheral effects of serotonin, this includes it affects vascular tone, particularly for most blood vessels. It causes vasoconstriction. Again, for most blood vessels, it causes vasoconstriction. For most blood vessels, it causes vasoconstriction. For the extravascular smooth muscles, let's say for instance in the bronchial smooth muscles, it causes naman bronchospasm or bronchoconstriction. Okay. It is also very important for hemostasis, as mentioned earlier. Very important siya for thermoregulation. For cell regeneration, heart functions. Okay. It somehow causes increase inotropy. Okay. Increase inotropy, increase chronotropy. Okay, so those are the heart functions, heart effects of serotonin. Another is intestinal motility, knowing that it enhances peristalsis. Okay, it enhances peristalsis. Okay, kung enhance yung peristalsis, increase yung GIT motility, GIT movement, that will lead to bowel movement or diarrhea. Okay. And other important peripheral effects of serotonin. So these are just general peripheral and central effects of serotonin once available for action. Now let us proceed to the serotonin receptors. Okay. So under serotonin receptors, please focus only to the following highlighted receptors. So we have 5-HT1A, 5-HT2A, HT1D, 5-HT3. Okay. We also have 5-HT4, 5-H2B, and 5-H2. In general, we actually have 7 serotonin receptors. Again, overall, there are 7 serotonin receptors. But what will I be discussing to you is only 5 of the most commonly targeted ng mga serotonin receptors ng mga available drugs in the market. Okay, again, I will be discussing only those receptors that are commonly targeted by the drugs available in the market. So, do not focus sa mga drugs, yung mga kulay green nga box or kulay pink nga box. Just focus first on the receptors itself. So, I'll start with the serotonin 1A. Okay, again, number 1, for the receptors, serotonin 1A. Okay? Ayan. Now, by the way, for most of the serotonin receptors, they are considered GPCR. Okay? They are considered GPCR or G protein coupled receptors as well. Okay? Except serotonin 3. Okay? All the 7 serotonin receptors are GPCR except serotonin 3. Okay? So, sulat ko ha. They are all GPCR except serotonin 3 receptor because this is an ionotropic receptor or a ligand-gated ion channel receptor. Okay, so let's resume. Okay, go back with number 1, serotonin 1A. Okay, serotonin 1A, this is located in the presynaptic, okay, neurons. Again, this is located in the presynaptic part of the CNS. Take note, present siya in the presynaptic part of the CNS. Okay? Particularly, this is a GI linked. Okay? A GI linked receptor. So, somehow it has an inhibitory effect. Now, 5-HT1A, serotonin 1A receptor, it is stated here that it is located in the presynaptic neuron. Therefore, autoregulation will happen upon stimulation of serotonin 1A. So take note, there will be inhibition. There will be inhibition of serotonin release. So take note, there would be neuronal inhibition. Okay, because again, the said receptor is present in the presynapse. Autoregulation will happen, inhibition of serotonin release. So that's it for serotonin 1A. Let us proceed to number 2. We have here serotonin 2A. Okay? Serotonin 2A, but since yung drug will later nga ma-discuss, will target A2A and 2B, we will discuss here serotonin 2A slash 2B receptor. Okay? So we also have serotonin 2A, 2B. Okay? Serotonin 2A and 2B. Serotonin 2A, 2B subtype. This is actually found in the smooth muscles. Okay? In the figure, it says in the brain, 'di ba, na ay structure mo siya shadow nga structure nga brain. Okay? So lahat ng nakikita yung receptor dito, they are all located in the brain. That is correct. Okay? But I am referring here serotonin 2A, 2B. Serotonin 2A, 2B, they are much more distributed in the smooth muscles. They are found in the smooth muscles, particularly what smooth muscles in the body, particularly smooth muscles in the uterine, okay, and also mga vascular smooth muscles. And what is the effect upon stimulation of serotonin 2A, 2B receptor? Okay, stimulation of 2A, 2B receptor causes contraction. Why? Because this is a GQ linked receptor, GQ linked receptor that will later on send secondary messengers IP3 and DOG, enhances the levels of intracellular calcium ion, thus contraction will happen to that particular vascular smooth muscle. So please take note, in the blood vessels, it will cause vasoconstriction. In the uterine smooth muscle, it will cause uterine contraction, or what is the medical term for uterine contraction? That is oxytocic effect. Okay, that is, again, the medical term for uterine contraction, oxytocic. That's the opposite of tocolytic. Tocolytic is the relaxation of uterine smooth muscles. Again ha, I am not referring to serotonin 2A only. Kasi yung 2A, yes, that is present in the brain. Okay? But I am referring here to serotonin 2A, 2B subtype nga receptor. Kasi later on natin ma-discuss nga drugs targeting serotonin 2A, 2B. Okay? Which is commonly used, okay, today. Okay. Next, we also have pala serotonin 1B, 1D. Okay? Supposedly, this should be number 2, no? Kay 1 man siya, 1 B, 1D receptor. So sa figure, yung nakalagay lang is serotonin 1D. That is present in the brain. But now I am referring to receptor. Take note, this is found in the peripheral blood vessels. Again, this is found in the peripheral blood vessels. Okay? Take note, this is also GI linked. Okay? So in the peripheral blood vessels, stimulation of serotonin 1B1D subtype receptor causes vasoconstriction. Okay, take note. This causes vasoconstriction. Even serotonin 1D alone present in the brain, that causes vasoconstriction as well. Okay, number 4, we have serotonin 3. Okay, number 4, we have serotonin 3. For serotonin 3, take note, this is commonly found in the area postrema of the brain. So this is located in the brain, particularly in the area postrema of the brain. Okay. Okay, take note that serotonin 3 receptor is said to be present in the brain, particularly this part, this postrema area of the brain I am referring to is actually the vomiting center. This is the vomiting center. Once ma-trigger ni siya nga portion sa brain, it induces vomiting to a patient. Okay? Or this is also known as the KTZ zone. I mean CTZ zone. Or the chemoreceptor trigger zone. Okay, chemoreceptor trigger zone. Okay, again, what is the effect? Emesis. So please take note of this effect. Okay, later on, ma-relate niya siya sa drugs. Okay, again, for serotonin 3, it induces emesis. Okay, once ma-activate ang serotonin 3 receptor in the CTZ, okay, of the brain, emesis will happen. That is why if you try to observe those patients nga ga-undergo og chemotherapy, radiation, normal sa ilahang nga magsuka. Okay, normal sa ilang nga magsuka right after chemotherapy or few days after chemotherapy. That is because na-trigger ang ilahang area postrema of the brain, okay, inducing emesis. That is why they are given with anti-emetic agent. Okay, those patients with or just done with chemotherapy session, they are recommended with anti-emetic, okay, particularly those drugs that are serotonin 3 blockers, okay, to inhibit emetic effect or emesis. Okay, and then finally, serotonin 4. Okay, for serotonin 4, ayan. You have here serotonin 4, di ba? Sabi dito, present siya in the intestine. By the way, ito yung serotonin 2. Ayan. which causes vasoconstriction. Okay, in general, serotonin 2 that causes vasoconstriction. Ito, 2B, this is a special one. Okay, this is a special one kasi kapag may serotonin na nakapag-bind sa serotonin 2B alone, 2B subtype, this is actually an endothelium-mediated nga receptor. So once ma-activate siya, this will release an endothelium derived na mga relaxing factor. Example, nitric oxide. And nitric oxide, I have mentioned this sa mga prior discussion na this is a vasodilator. That's why nakalagay dito, dilation. This is a special case for serotonin 2B. Okay, 2B subtype. Here, I am referring to 2A, 2B. 2A, 2B subtype, GQ-linked vasoconstriction. Okay? Next. For serotonin 4, sabi ka sa figure, it is present in the intestine, particularly in the gastrointestinal tract. Take note, this induces peristalsis. Diba? Sa general peripheral effect, yung action ng serotonin, once available, is yahang gina-enhance ang GI motility. So, it enhances GI motility, causing peristalsis. Ultimately, bowel movement or diarrhea. Okay, so we are done with the receptors. So let's have a recap. Take note. We have actually 7 serotonin receptors, but what I presented only are the 5 most targeted receptors na mga drugs that will be tackled later on. Okay, so we have serotonin 1A, a GI-linked receptor found in the presynapse. Autoregulation will happen. Activation of serotonin 2A, 2B, which is a GQ-linked receptor, it causes vasoconstriction and contraction of uterine smooth muscle. Activation of serotonin 1B, 1D in the peripheral blood vessels, it causes vasoconstriction. Serotonin 3, which is an ionotropic receptor. This is present in the CTZ, which induces emesis. And finally, serotonin 4, which is present in the GIT. It enhances peristalsis. Now, this is just a summary for the drugs under serotonin. Those drugs that target serotonin receptors. Let's start with those drugs, okay, that affects serotonin 1A. Okay, drugs that affects serotonin 1A, we have buspirone. Okay, buspirone. This is considered a partial agonist, okay, of serotonin 1A. Again, this is considered or classified as a partial agonist of serotonin 1A. Repinotan is a full agonist. Okay, full agonist of serotonin 1A. What are the uses of these drugs which activate serotonin 1A? They are actually used to patients with anxiety. Okay, kasi with too much serotonin, okay, that causes imbalances to the mood of the patient. Okay, so to regulate, okay, we can have anxiolytics, which is buspirone, okay, which is a partial agonist, or you can have a full agonist, okay, of serotonin 1A. So these are used as anxiolytic. Okay, anti-anxiety drug, anxiolytic. This will be much more discussed under CNS drugs. Okay, then for drugs or activators of serotonin 1B and 1D, okay, serotonin 1B, 1D, activators, we have the triptans. Okay? Triptans, example, sumatriptan, zulmitriptan, naratriptan, rizatriptan. Okay? Among these four triptans, activators of serotonin 1B, 1D, based on clinical trials, this is most bioavailable. Okay, once administered, this is much more bioavailable in the body. Okay? So what would be the effect? Again, kapag na-activate yung serotonin 1B, 1D, recall, 1B, 1D, vasoconstriction. Okay, that is why, take note, effect is vasoconstriction. Okay. What is the use of triptans? If you search for triptans drugs, they are considered anti-migraine. Okay, anti-migraine. So used in the management of migraine headache. What is the pathology? What is the underlying cause? Bakit nagkaka-migraine? Bakit may throbbing pain kapag may migraine? Okay? Yung pathology, okay? Pathophysiology, underlying cause, bakit may migraine is that due to dilation of the blood vessels. Okay? Okay, this is due to dilation of the blood vessels in the brain. Okay? That is one of the underlying factors that mediates pain, okay, in the head. Okay? Yung pain sensation in the head during migraine. That is why, because of the dilation, di ba, this mediates pain, the dilation, the vasodilation in the brain, since it mediates pain sensation, with medication that acts centrally, okay, na merong vasoconstricting effects, they can be used to treat the throbbing migraine, okay, the throbbing headache, okay, to subside. Okay, ilahang manage ang throbbing pain caused by migraine, okay, via constricting the blood vessels in the brain. Now, since meron siyang vasoconstricting effect, somehow, it will affect the blood pressure, okay? Particularly, it will enhance blood pressure, causing hypertension. Okay? So this is just a side effect. That is why contraindicated, bawal, okay? Or kung hindi bawal, kailangan controlled, no? Ang paggamit ng triptans to patients with hypertension. Kasi nga, centrally, okay, then systemically, meron siyang vasoconstricting effect. So, contraindicated siya to patients with hypertension and to those patients with CAD. Patients with CAD, abnormal yung coronary artery nila. Okay? Coronary artery disease na siya. Coronary artery disease that is manifested having a coronary artery na merong mga plaque. Okay? Na mga lipids. Okay? Nga stick on the walls of the artery. And that causes narrowing. Kikipot yung daanan ng blood. Okay? Kikipot yung daanan ng blood. So, kung napag-vasoconstriction, okay, nga effect, that will further lead to chest pain to patient. Okay, that's why delikado ang pag-intake ng triptans to patients with coronary artery disease. Kasi nga, it may cause chest pain, or yung medical term ng chest pain is angina pectoris. Okay, so that's it for drugs that targets serotonin 1B, 1D agonist. These are agonists, ha? Effect is vasoconstriction. Main use nila is for acute, anti-migraine sila, for acute migraine headache. Next, we have number 3, agonist. Agonist of serotonin 2A and 2B, agonist of serotonin 2A and 2B. We have ergotamine. Ergotamine, this is an alkaloid together with ergometrine. These are alkaloids, di ba? Alkaloids ni sila nga na-derived from rye nga plant or yung scientific name Claviceps purpurea. Diba? These are alkaloids nga ma-derive sa plant nga Claviceps purpurea, ergotamine, ergometrine. Okay? So as an agonist of serotonin 2A and 2B, they causes vasoconstriction. Okay, constriction of the vascular smooth muscle. For ergotamine, take note, this is vasoselective. So yung action niya is towards vessels, blood vessels. Okay, vasoselective siya. Whereas ergometrine, yung target smooth muscles niya is yung mga sa uterine smooth muscles. That is why this is uteroselective. This is uteroselective. So generally, they causes contraction. Activation man. Activation of 2A, 2B. Okay. Activation, take note. Activation of serotonin 2A, 2B. There is contraction. Okay. So for the vessels, vasoconstriction. For the uterine smooth muscles, contraction of uterine. Okay, smooth muscles. So take note. So ergometrine, again, this is used for the management of migraine, headache, because of its vasoconstricting activity, whereas ergometrine is used for the management for postpartum hemorrhage. Okay, for postpartum hemorrhage because of its oxytocic activity. Diba? Meron siyang ability to contract uterine smooth muscles. Or oxytocic. Meron siyang oxytocic effect. That is the medical term for contraction of uterine smooth muscles. But this is not the first line. Ergometrine is not the first line for the management of postpartum hemorrhage. The first line pa rin is oxytocin. Okay, we actually have an IV ampule available nga oxytocin. Okay, so that is still the first line agent, okay, for postpartum hemorrhage. Now let us proceed to antagonists. So we also have antagonists of these receptors, serotonin 2A, 2B. Okay, we have methysergide. So as an antagonist, instead of vasoconstriction, this is used as this has an effect of vasodilation. So ginagamit siya before to prevent migraine. Okay, but this is not used anymore. This is not used anymore because of its side effect. Okay, meron siyang side effect which is severe retroperitoneal fibrosis, yung proliferation of the peritoneum. Okay, this is actually a side effect of those ergot derivatives, kani ergotamine, ergometrine, but not so pronounced. Okay, it can be controlled. Okay, but for methysergide, very much pronounced yung retroperitoneal fibrosis na kinokos niya. Then these are the other side effects of ergot derivatives as a whole. Okay, for all the ergot derivatives, these are the side effects. Okay, enhance yung BP. Okay, enhanced yung BP obviously because of its vasoconstricting, di ba? Recall the ergot derivatives, they are GQ. I mean, they activate the serotonin 2A, 2B, which is a GQ-linked receptor. GQ, Q contraction. Okay? So, increase yung BP because of the vasoconstricting activity. And other side effect is oxytocin, okay, effect. And lastly, this is also considered an antagonist. Okay, this is also considered as an antagonist of, ayan, serotonin 2A, 2B, ketanserin. Ketanserin, this is used in Europe. Okay, this is legally used in Europe. This is particularly given to hypertensive patient kasi meron siyang anti-hypertensive activity, mainly due to its miscellaneous action. Okay, meron siyang alpha-1 blockade activity. So aside from its blocking activity towards serotonin 2A and 2B, meron din siyang alpha-1 blockade activity which causes vasodilation. Recall nga blocking alpha-1 receptor causes vasodilation. Okay. Next, serotonin 3. Drugs that block serotonin 3 receptor are very much useful, especially to patients undergoing chemotherapy. Okay. So take note, antagonists of serotonin 3 receptor are those ending in citron. So dumdumi, kung serotonin 3 receptor blockers, we have citron, granisetron, ondansetron, palonosetron, dolasetron. Okay, effect again upon blockade, di ba? Blockade of serotonin 3 receptor, anti-emetic yung effect. That is why pwede siya in the management of chemotherapy-induced nausea and vomiting. Yung mga patients na kakagaling lang chemotherapy, radiation na exposed, very triggered yung CTZ portion ng brain nila, kaya nasusuka sila. So they are recommended with anti-emetic drugs, particularly serotonin 3 blockers, mga citron. Routes of administration for most of the citrons are per orem. There are also drugs given IV, depending on the case of the patient. But special case for granicitron, take note, for granicitron, it has a transdermal patch. Okay? So, merong available na transdermal patch for granicitron. And important thing to note about palonosetron, it has a half-life of 40 hours. Okay, imagine, yung half-life, yung palonosetron, 40 hours. Okay? So, more than days, di ba? So, we can infer then na having this prolonged half-life, yung single IV dose lang niya will last for almost 5 days, di ba? So, take note, a single IV dose ng palonosetron that will last for 5 days. Okay? So that's the important thing you have to note about palonosetron. And allosetron, aside from its ability to block serotonin 3 receptor, meron din siyang ability to block, it also block serotonin 4 receptor. Okay. Again, it also has the ability to block serotonin receptor 4. Okay, serotonin 4 receptor. Okay, which is, take note, located diba yun sa GIT. Again, ang serotonin 4 receptor is located in the GIT. So, kung i-block ang serotonin 4 in the GIT, decrease yung motility of the gastrointestinal tract. That's why pwede siya in the management of IBS, okay? Irritable bowel syndrome with diarrhea. Okay, for those patients with diarrhea associated IBS. Okay, then finally, agonists. We have agonists of serotonin 4. Agonists, they are activators of serotonin 4, nagpapa-enhance ng GIT motility therefore. Okay, so we have tegaserod and cisapride. Okay, ito sila are actually classified as partial agonists, okay, of serotonin 4 receptor. Okay, so ginagamit sila for the management of irritable IBS with predominant constipation. Okay, and finally we have prucalopride. Prucalopride naman is a full agonist. Okay, this is also used for constipation but a chronic stage ng constipation kasi this is a full agonist. Okay, it is able to enhance the GIT motility, causing diarrhea. Okay, so that is all for serotonin.